we're going to start by talking about the skeletal muscles and the skeleton. Skeletal muscles are attached to the skeleton at various locations throughout the body. These muscles attach to the skeleton via tendons. There is a fascial covering that helps skeletal muscles and skeleton attach to each other through blending the connective tissue of our bones and muscles. This is known as an epimysium. Skeletal muscles allow us to voluntarily move the various joints and bones in our skeleton in order to help escape danger, be physically active, and do activities of daily living. Skeletal muscles also work with the skeleton to maintain posture. The skeleton provides the framework of our body, and through connections of the muscles, it allows humans to keep an upright posture needed for everyday activities such as sitting up, walking, running, etc. The body is able to perform specific movement through joints and skeletal muscles that can help provide protection and stability of the joints to help with their overall health. As skeletal muscles voluntarily move through physical activity or activities of daily living, they pull on the bones, which helps increase bone health. For example, resistance training helps increase bone density through tendons pulling on the bones, causing microtrauma to the bones with every muscle contraction, which in return causes the bone cells to activate, resulting in an increased bone density through osteogenesis.
The cardiovascular system provides oxygen for the function of skeletal muscles. Oxygen binds to the hemoglobin of the red blood cells, which allows it to be carried to the site of skeletal muscles all around the body. The amount of oxygenated blood that flows to the various parts of the body, including skeletal muscles, is controlled by how dilated or how constricted the blood vessels are. For example, when the sympathetic nervous system is activated, there is vasodilation to the arteries that supply skeletal muscles. In a parasympathetic state, there is relative vasoconstriction to these same arteries. One explanation for this is the metabolic theory. This states that when a body tissue is more active, it will have more blood flowing to it, which will bring nutrients and clear waste products. Further, there are some cardiovascular changes that occur when the skeletal muscles are working during exercise. Increased heart rate. With exercise, there is increased activity of the sympathetic nervous system, which acts on the sinoatrial node to increase heart rate. Increased contractility. The increase in sympathetic stimulation also leads to the heart contracting with more force, which decreases the end systolic volume of the heart. Increased venous return. With exercise, there is more activity and contraction of the skeletal muscles, which helps to squeeze the venous blood back towards the heart. Additionally, breathing heavier means that there is more respiratory pump activity as well. The increase in venous return leads to an increase in the end diastolic volume of the heart. Increased blood pressure. As a person exercises and their heart beats faster, there is often a rise in blood pressure as well. A rise in blood pressure is normal during exercise as long as the blood pressure drops back to baseline after the person stops exercising. Vasodilation of the blood vessels to the skeletal muscles. When the skeletal muscles are working, they produce vasodilator metabolites. This leads to the arteries that supply the skeletal muscles becoming more dilated, thus bringing more blood towards the working muscle to supply nutrients and clear out waste products. These vasodilator metabolites are not produced by inactive muscles. Now we'll discuss the skeletal muscles and the respiratory system. Skeletal muscles need oxygen to function, and the respiratory system is the system that brings the oxygen into the body. Oxygen travels through the bronchopulmonary tree upon inhalation and eventually reaches the alveoli. The alveoli are the site of gas exchange with the capillaries. There needs to be adequate ventilation and perfusion at this site for adequate oxygen to reach the blood for delivery to the skeletal muscles. Oxygen demand increases with exercise, and thus respiratory rate will also increase. Working muscles need ATP for energy, and oxygen is required for the majority of ATP formation. As well, heavy breathing during and after exercise helps to repay the oxygen debt in skeletal muscles and helps to get rid of the waste products that have built up in the muscles. Breathing harder helps replenish the oxygen that has been used. The additional oxygen is used to restore the oxygen reserves in myoglobin and hemoglobin to help remove the lactic acid that is built up and helps to build up ATP stores again via oxidative phosphorylation. Bronchodilation also occurs during exercise. Exercising skeletal muscles produce more carbon dioxide than normal as they use up oxygen. The airways respond to increased carbon dioxide levels, which leads to bronchodilation to help get rid of the extra carbon dioxide in the body. Skeletal muscles, such as the diaphragm, are needed to support the process of breathing as well. While breathing is often an automatic process, you can still recruit skeletal muscles to breathe at a chosen rate and depth. Upon inspiration, respiratory muscles will contract to increase the diameter of the thoracic cage, which helps to draw air into the lungs. For expiration, the respiratory muscles relax, which decreases the diameter of the thoracic cage, which helps to push air back out of the lungs. Inspiration is always an active process, but expiration is only active during heavy breathing, like with exercise. Other skeletal muscles may be utilized as accessory muscles of respiration, such as the intercostals, the scalenes, the sternocleidomastoid, the trapezius, and the pectoralis major. The endocrine system also has an impact on skeletal muscles. Endocrine glands release hormones into the blood to be delivered to various body systems to influence their functioning. The levels of various electrolytes, such as sodium, potassium, or calcium, can be influenced by the hormones produced by the endocrine system. These electrolytes play a large role in the contractility of skeletal muscles and their ability to produce action potentials. Growth hormone is released by the anterior pituitary gland. This hormone acts to promote growth of the skeletal muscles. The anterior pituitary gland also releases thyroid-stimulating hormone, which acts on the thyroid gland to promote the secretion of T3, T4, and calcitonin. Calcitonin plays a role in calcium homeostasis, which influences skeletal muscles, as calcium homeostasis is essential for the contraction of these muscles. T3 and T4 act on skeletal muscle cells to increase mitochondria number, thus increasing oxygen consumption, increase metabolic function, increase heat production by the cell, and increase cell energy. This increases muscle activity. Dysregulation of the hormones produced by the thyroid gland can impact the skeletal muscles as well. Hyperthyroidism can impact the skeletal muscles by causing hyperactive, jerky muscles, as seen when trying to elicit a deep tendon reflex. Hypothyroidism can make skeletal muscles more sluggish and decrease the deep tendon reflex. Aldosterone secretion from the adrenal cortex regulates the potassium ion concentration in the extracellular fluid. Tight regulation of potassium concentration is very important for maintaining resting membrane potential to allow for appropriate skeletal muscle contraction. If the concentration of potassium in the extracellular fluid drops too low, there will be weakness of the skeletal muscles, as they won't be able to contract as effectively. As well, hyposecretion of aldosterone can lead to acidosis, which leads to increased ionized calcium levels. This can cause tetany of the skeletal muscles. Cortisol is another hormone that is secreted from the adrenal cortex. If there is increased cortisol levels from the adrenal cortex, the cortisol will act on skeletal tissues to have an anti-insulin-like effect to preserve glucose for the brain and the heart to use. Excess cortisol may lead to muscle atrophy. The adrenal medulla secretes epinephrine and norepinephrine, two hormones that are part of the activation of the sympathetic nervous system. These hormones can act to dilate blood vessels going to skeletal muscle so that the muscles receive more oxygen and can work harder to respond to the environmental stressors. Skeletal muscles are also insulin dependent. Insulin is secreted by beta cells in the pancreas in response to stimuli like rising blood glucose levels. Skeletal muscles require insulin to stimulate the uptake of glucose from the bloodstream. This is necessary as glucose is a major source of fuel for these muscles. There are a few links to be made between the skeletal muscles and the reproductive system. The cremasteric muscle is a skeletal muscle that helps with the thermoregulation of the scrotum. When the cremasteric muscle contracts, the scrotum is elevated. The elevation of the scrotum helps to increase the temperature inside the scrotum if the external environment is too cold. Likewise, relaxation of the cremasteric muscle allows for the scrotum to lower, which cools down the testes. The cremasteric muscle is also involved in the cremasteric reflex, where stroking the inner thigh leads to a reflex contraction of this muscle. Testosterone is a hormone that is secreted by the testes. While this is how most of the testosterone in males is produced, there are also some testosterone precursors that are produced by the adrenal cortex in both males and females. Additionally, small amounts of testosterone may be produced by the ovaries in females. Testosterone has anabolic effects on various tissues in the body, including the skeletal muscles, which leads to an increase in muscle size and strength. Another relationship between the skeletal muscles and the reproductive system is via the pelvic floor. The pelvic floor is made up of a sheet of skeletal muscles that support the pelvis and the abdominal and pelvic organs. After a female goes through menopause, there is a drop in the level of estrogen in the body. One of the effects of this drop in estrogen is that the pelvic floor muscles may experience dysfunction. This may lead to other side effects, like reduced bladder control.
Skeletal muscles play a role in the digestive system. In the GI tract, there are 4 basic tissues: serosa, submucosa, mucosa, and muscularis. The muscularis tissue is made up of skeletal muscles or smooth muscles and are arranged in a circular muscular layer and a longitudinal muscular layer. The skeletal muscles of the digestive tract are located in the mouth, pharynx, superior middle part of the esophagus, and anus. Skeletal muscle involvement in the digestive system is only at the beginning and end of the system, and it begins in the mouth. There are 4 muscles used in mastication or chewing, which are temporalis, masseter, lateral medial pterygoid. These muscles attach to the rami of the mandible and move the jaw when they contract. The act of chewing is a rhythmic reflex. This is brought by activation of skeletal muscles in the jaw, lips, cheeks, and tongue due to feedback from pressure of food on these tissues. This reflex is an automatic rhythmic reflex, but we can voluntarily control the muscles through sending voluntary information to control mastication, which can increase or decrease the speed of chewing or stop it altogether. Swallowing is the next step in the digestive process. Skeletal muscles of the tongue are the first muscles initiated for swallowing. The oral stage of swallowing is the only voluntary stage where skeletal muscles are involved. The muscles of the tongue help collect the food and create a bolus, where the tongue then pushes the bolus upward and backward against the hard palate to push food into the pharynx. When the bolus is pushed against the pharynx, it initiates an involuntary response through the pressure receptors in the pharynx. This activation of pressure receptors causes an efferent motor impulse to be sent from the cranial nerves. These efferent signals ensure movement of food occurs, and they ensure the food bolus does not enter the nasal cavity or trachea. These efferent signals activate the swallowing reflex. The swallowing reflex ensures the muscles of the soft palate, the pharynx, contract to prevent food in the nasal cavity. The uvula contracts and is pulled upward to close the posterior nares, preventing food from entering the nasal cavity. The efferent fibers from cranial nerves will cause relaxation of the tonic skeletal muscles of the upper esophageal sphincter to allow it to open and move food from the pharynx to the upper esophagus. In the defecation reflex, the pudendal nerve supplies the external anal sphincter, which is a skeletal muscle. When food descends through the digestive tract and causes distension of the rectum, this reflex is signaled. The distension of the rectum causes an increase in the continuous tonic contraction of the external anal sphincter, and when stimulation from the pudendal nerve is strong enough, there is continuous relaxation to allow for defecation to occur. There is skeletal muscle involvement in the renal system. Skeletal muscles protect the kidney from physical injury and support the kidneys as well. When there is a uremic environment in renal failure, meaning excess or unwanted metabolites and disturbed homeostasis, there will be many comorbidities that affect the muscles. These comorbidities cause the individual to decrease physical activity, and this reduction in physical activity leads to less use of the muscle, causing muscular atrophy. The micturition reflex uses skeletal muscles. The micturition reflex is subject to both conscious and unconscious control from higher brain centers. The external urethral sphincter is a skeletal muscle that receives innervation from the somatic voluntary nervous system through the pudendal nerve. When action potentials are sent through the pudendal nerve, the external urethral sphincter will be stimulated and contract as well as become tighter, inhibiting urination. When urine fills the bladder and higher brain centers decide it is an appropriate time for micturition, there is inhibition of the somatic motor neurons, resulting in less action potentials traveling through the pudendal nerve, causing the external urethral sphincter to relax, and micturition can occur. I'm going to talk about the interaction between the skeleton and the cardiovascular system. The cardiovascular system relates to the skeletal system through a degree of permeability of the capillaries. The capillaries involved with bone marrow are discontinuous sinusoidal capillaries. These capillaries have many large fenestrations and clefts between endothelial cells. The basement membrane is not continuous. These factors allow this type of capillary to have the highest degree of permeability within the body. There needs to be very high permeability between the skeletal system, specifically the bone marrow, due to red blood cells. The bone marrow is responsible for the creation of red and white blood cells. However, the white blood cells can fit and diffuse through non-fenestrated capillaries. The red blood cells, on the other hand, are large molecules that cannot fit through non-fenestrated or fenestrated capillaries, resulting in the need for bone marrow to have the discontinuous sinusoidal capillaries for red blood cells to diffuse through. After diffusing through the discontinuous sinusoidal capillaries, the red blood cells then travel to the lungs, where they are then oxygenated and can travel throughout the body to their destination, oxygenating different organs throughout the body. Next, I'm going to talk about the skeleton and the respiratory system. The skeleton relates to the respiratory system by protecting the main respiratory organ, the lungs. However, the skeleton plays an important role even before the lungs. The nose is the first place of the upper respiratory tract, or the conductive zone, where the skeleton has importance to the respiratory system. The bones and cartilage in the nose allow it to keep its shape as we breathe in oxygen. Being able to keep its shape supports optimal oxygen intake, allowing humans to inspire deeply, and also helps us breathe clearly. There's also cartilage in the trachea, and it is held open by incomplete rings that are C-shaped. The C-shaped rings allow for transport of air from the pharynx all the way down to the tracheobronchial tree. The main bronchi is made up of ring-shaped cartilage that completely encircles the lumen, where secondary and terminal bronchi are made up of the C-shaped cartilage that's in the trachea. This cartilage, through the conducting portion of the respiratory system, keeps the trachea and tracheobronchial tree open to allow for oxygen to meet in the alveoli in the lungs and go through gas exchange. The lungs are protected by the skeleton through the ribs and the sternum. Ribs 1 to 7 are attached to the costal cartilage via the condocostal joints, and a costal cartilage is attached to the sternum anteriorly via the sternocostal joints. Ribs 7 to 10 come together and attach via interchondral joints to create the costal cartilage, where it is attached to the sternum at rib 7 via the costochondral joint. Ribs 11 and 12 do not attach anteriorly and are known as the floating ribs. Each rib attaches to the vertebrae posteriorly via the costovertebral joints. The cartilage allows for the rib cage to expand by moving upwards and outwards during inhalation and downward and inward during exhalation, making room for the lungs to expand and the diaphragm to move up and down. This movement is vital for the mechanics of breathing and ensuring proper lung function when there is changes in the intrapleural and transpulmonary pressure gradients. The respiratory also oxygenates the red blood cells, which is made by the bone marrow in the bones, and then they travel out throughout the body to oxygenate the organs.
There are many hormones involved in bone remodeling. Hormones determine if and when bone remodeling occurs, and hormonal mechanisms maintain calcium homeostasis in the blood. We know the role of osteoclasts is bone resorption, and the role of osteoblasts is bone depositing, both of which are controlled by some hormones. Moreover, thyroid hormones, growth hormone, and sex hormones such as estrogen and testosterone all help control the longitudinal growth of bones. Thyroid hormones are anabolic and help in production of the bone matrix. They also have cholinergic effects, and they affect secretion of the growth hormone. For example, a child that has low thyroid hormone levels but normal levels of the growth hormone will have interrupted growth. Hypothyroidism is a condition in which the thyroid gland is not formed, and in turn it affects skeletal growth, so that all bones appear to be smaller in size. The growth hormone is also anabolic and has an indirect effect on growth. With regards to sex hormones, they cause growth spurts during puberty and speed up the rate of proliferation and ossification of cartilage. Sex hormones also promote the conversion of the epiphyseal plate to the epiphyseal line, resulting in the closure of the epiphyseal growth plates. Thus, this brings an end to the longitudinal growth of bones. These hormones also shape our skeleton to match the sex, which is a prime reason as to why hip bones differ in males and females, as an example. The parathyroid hormone is also concerned with calcium metabolism. To quickly summarize, the parathyroid gland is located in the posterior aspect of the thyroid gland and secretes the parathyroid hormone. Thus, the function of this gland is to regulate the concentrations of calcium in the extracellular fluid. Parathyroid hormones increase plasma concentration of calcium by releasing calcium from bones by stimulating osteoclasts and causing bone resorption. This results in dissolving of the hydroxyapatite crystals to allow both calcium and phosphate to be released into the blood. The plasma phosphate level also gets decreased as the parathyroid hormone works on the kidneys to decrease the level of phosphate. As the kidneys reabsorb calcium back into the blood, they also secrete excess phosphate into the urine. The parathyroid hormone also acts on bones in two ways, immediate and delayed. In the immediate effect, it occurs within minutes to hours and transfers calcium from the labile pool into the plasma. In the delayed or chronic effect, which takes days to weeks, the parathyroid hormone localizes dissolution of bone into plasma. Hydroxyapatite crystals will be transferred to calcium and released into the plasma. Note, calcium in our bones is present in two forms. Majority is deposited as the hydroxyapatite crystals, and a small amount is present in the labile pool. Calcium helps form the ground substance, which helps make up the bone matrix. The hydroxyapatite crystals is precipitation of calcium and phosphate, and without these crystals, our bones will not be very strong and there will be difficulty resisting any weight or pressure. Lastly, calcium levels in the blood regulate the parathyroid hormone. This is a negative feedback relationship between plasma, ionized calcium, and the parathyroid hormone secretion. When plasma calcium levels drop, the parathyroid hormone secretion is increased to return that calcium level back to normal. Furthermore, calcium ions affect the parathyroid hormone secretion by acting as special receptors in the parathyroid gland. These receptors are called calcium-sensing receptors. In a condition known as hypercalcemia, there is reduced binding of calcium to the receptors, resulting in release of the parathyroid hormone from secretory granules. Moving on to the skeleton and its connections with the reproductive system. Testosterone increases the size of bones as well. For example, shoulders broaden during puberty. It also has anabolic effects because androgens increase synthesis and decrease breakdown of protein, leading to an increased rate of growth and maintenance of bone mineral density. Reminder, this bone growth occurs until ossification of the epiphyseal plate. Estrogens also increase the growth rate of the skeleton at puberty for several years, but they cause uniting of the epiphysis of the long bone. Estrogen also increases osteoblast activity and decreases osteoclast activity. Estrogen directly regulates osteoblast activity and increases osteocyte survival by inhibiting cell death, whereas they increase cell death both directly and indirectly on osteoclasts. Next, sexual dimorphism begins as early as a fetal stage of development, and most of it develops in the pelvis during the growth spurt that occurs during adolescence. This is mainly genetically determined and grows in response to the sex hormones during puberty. To differentiate, the male pelvis is narrower, heart-shaped, more shallow with a narrow angle, whereas the female pelvis is much wider to help support childbirth, as an example. The bones also do their part to support the reproductive system, as the pelvis, the bony structure, protects the reproductive organs. Vitamin C, which also helps maintain bone health, if it is deficient, it results in decreased testosterone synthesis. Therefore, if we have healthy bones, we assume we have adequate vitamin C, which means synthesis of testosterone is maintained. The skeletal system and the digestive system also are interrelated. The skeletal system is dependent on the digestive system to increase its size and strength via nutrition. The digestive system gives us the nutrients and energy we need by absorbing and digesting our food, so that we can maintain good health, specifically for our skeletal bones in this example. More specifically, the small intestine absorbs the nutrients such as vitamin C, which is important for bone health. In addition, the liver is a reservoir for vitamin D, and the liver also balances both the inputs and outputs of the cholesterol from circulation. The liver is also the main site of cholesterol synthesis, and our body needs that cholesterol for vitamin D. Nonetheless, our bones return some benefits to the digestive system as well. The muscles of mastication attach on bones, which provide support and also allows us to chew our food. This in turn helps in the first stage of our digestive system, as it helps food move through the rest of the digestive system by converting our solid food into a bolus. The abdominal cavity also houses our digestive organs and is bordered by the abdominal wall. The posterior border of the abdominal wall is in fact our spine. Therefore, it is our bones that help support the abdominal cavity in place. Lastly, we'll be talking about the skeleton and its relation with the renal system. The renal system activates vitamin D, which plays a role in maintaining healthy bone. If vitamin D is reduced, we end up with weak bones, conditions like osteoporosis, and less activation of bone marrow. There are also many effects on our skeleton from impaired renal functions, such as bone, along with muscle loss, that are interrelated by both biomechanics and common exposure to uremic toxins. For an example, we have sarcopenia. This condition predisposes patients to a more sedentary lifestyle because the decreased activity further increases risk of falls, bone weakness, and fractures. We often see this in the elderly. Calcium also reaches the kidneys via blood, and based on our body's needs, calcium can be excreted in the urine if there is an excess of it. Parathyroid hormone also plays a role in the kidneys, which stimulates activation of vitamin D, again, which is important for bone health. In summary, there is great chiropractic relevance with all of our body systems. Chiropractic adjustments directly influence all the organs controlled by the nervous system. In short, this is because if there's a subluxation at any level of the spine, that can impact the nerves that exit the spinal cord at that level. As a result, it will impact its blood flow to the organ it may supply. In the chart on the slide, you see a great breakdown of all of the organs and its related spinal levels, which helps summarize this very well. It is also important to know the different conditions related with other body systems, so we can help differentiate if the patient's pain is related to our scope of practice or not. as we know a lot of symptoms we may get from our organs not functioning properly can mimic complaints of muscles. And a great example of this can be the radiation of shoulder pain from the gallbladder and the symptoms of a heart attack, such as arm pain. Therefore, if we understand a patient as a whole, which is one of the many reasons we have a very detailed health survey form as part of the intake process, we get a better idea of the patient's health and the problems they are experiencing with their health, whether it is pain-related or not. All in all, if we can differentiate whether or not the patient's chief complaint or reason of pain is under our scope of practice, as chiropractors we can refer them out to the specific health provider that can help them. In many scenarios, this can even help save a patient's lives if the condition requires emergency medical attention.